Emanuele Capobianco, the head of the Health and Care of the International Federation of the Red Cross and Red Crescent Societies, who joins us from Geneva. Even though you are Italian, we spoke at the beginning of the week. What is your assessment now of the situation in Italy?
The epidemiological assessment is that the number of cases are still going up. We are around 12,000 cases and more than 800 deaths. What we have seen on the ground is an increasing measure of containment put in place that are now on a much larger scale, both geographically and in terms of the activities that have been limited. We will have to see in the next 2 weeks what the impact of this will be. The good news is that in the initial red zone in Lombardy, we have seen that those measures that were taken there have actually contributed to reduce the number of cases. So these are the right measures. It will take though time to see the effects on the curve of the epidemic.
All right, so there is some good news coming from that red zone in Lombardy. And do you think that red zone should be extended and even to the rest of Europe?
Well, Italy, as Sonia was mentioning earlier, has progressively extended the red zone to include the entire country and limiting progressively all the major activities. And it's really a lockdown for the people in Italy. This has not been happening yet in many countries around Europe where the number of cases are going up.
And does that worry you? Does that worry you?
It does, pretty much so. France, Spain, Germany, Switzerland, we are seeing the number of cases going up daily. And it's surprising not to see a response that is stronger, that will be needed probably in later on. And the problem is, or I would say the advantage is, if you start early, you can contain it more easily. Every single day that the measures are delayed, there are enormous risks in terms of the ability to cope with this epidemic. So I'm concerned, and many scientists all around Europe are concerned that we are being a bit slow to respond to this, and we should be taking this outbreak more seriously.
And when you see what the US has done, imposing a travel ban from many European countries, what do you think?
Well, when a virus is circulating in the communities, as it is in the US, as it is in Italy and many other countries in Europe, a travel ban may not be particularly effective. What is needed is active action on the ground, testing people, isolating, quarantining, preparing the hospital, expanding the capacity of intensive care unit, preparing doctors and nurses, and communicating with people, informing them about what is happening, what is about to happen. We have seen in Italy, it took 2 weeks to get, I think, the people of Italy behind the tough decision that were taken by the government. It wasn't immediately appreciated, it wasn't understood. That is what is needed, and that's where we as a Red Cross are trying to pass the information, try to give to people instruments to understand what is happening and instruments to defend themselves and defend their communities.
Dr. Emanuele Capobianco, such a pleasure to speak to you. Really enjoy it.